infectious disease rotation at Mass General Hospital back in the early 1980s. And we were just seeing the very first cases of AIDS to be treated at the hospital. When it came time to choosing a research direction, it was clear that the most exciting problem that was being faced in ID and the biggest challenge, the greatest need, was in AIDS. And as we then shortly afterwards came to know HIV infection.
The first experience that I had was working in a county health clinic down in Tampa. And the thing that struck me back then, I didn't really know anything about medicine at the time, but was how people would come in, you'd get to know them over a period of months, and then suddenly they would be gone. And so you were losing all of these people really that were young, that were in the prime of their lives, and that really made an impression on me. So I thought it was important that the next generation of scientists, who maybe were not there at the beginning of the epidemic, contributed our part. And it's also a job that I really enjoy, and a job that I love.
And I kind of got bit by the bug, I guess you could say, where I really enjoyed where I could integrate science, but also have close contact with the patients that we were treating and the community of patients, and those that were infected with the viruses that we were studying. And I thought that HIV was a natural fit because there's true translational science being done, where the research being conducted is directly applicable to the patients themselves. I was a child of the late 80s and early 90s before there was antiretroviral therapy, and can remember there was a very different face of HIV/AIDS at the time.
I think my interest in HIV started when I did my medical school in San Francisco, and seeing HIV patients. I also had the opportunity to work abroad in hospitals in Mexico and Uganda as well, and did some clinical HIV work in China. And I noticed that while the locations were different, I think some of the challenges that these patients were facing were really very similar. Some of the struggles that these patients had in fighting discrimination and for dignity as well. And I think it really inspired me to go into HIV. I always, I think, hoped that that I could contribute even if a small part of finding a cure for my patients, that would be something really worthwhile to do.